Well, hello. I'm Lainey, also known as Electro Girl, and I'm an advocate for empowering people to get back in the driver's seat of their diagnosis. See, I was diagnosed with epilepsy 30 years ago and basically was never satisfied with hearing from a doctor that pharmaceuticals would be the only approach to controlling my seizures. I just wasn't going to take it.
Out of my way, mortal!
So I committed many years to researching and finding an answer outside of the Western medicine approach to find a more holistic approach in managing and treating my epilepsy and the seizures. The Love Your Diagnosis podcast is a show about exactly that. Each week, we will be looking into the life of someone who has been diagnosed with a condition or illness and has succeeded in managing their diagnosis both in and outside of Western medicine. To start off, we will look at the Western medicine prognosis and approach to dealing with their diagnosis inside the square. Then, we'll dip our toes a little deeper into their story, where we talk about other empowering modalities that worked for those people outside of that square. Basically, what put them back in the driver's seat of their diagnosis. So hang around with me while we explore living in and outside the medical square when it comes to loving your diagnosis. Okay, hi, and welcome to the Love Your Diagnosis podcast. I'm here today with Briony Swart, and we're going to be talking about, well, firstly, introduce yourself, what you've been diagnosed with and how long ago that was.
Yeah, no worries. So it was in 2013, and I was diagnosed with cervical cancer and a suspected lymph metastases in my left pelvis. It was just picked up from a routine pap test, so I didn't have any symptoms at the time. So that was a good thing that it was picked up.
How often were you having pap smears?
Yeah, I've been very, regular every 2 years. The system's changed since then, of course. It's a bit different now. I was a bit later. It was about the 2.5 year mark because I had a 1-year-old. And I had just recently stopped breastfeeding him and then got around to, going to the doctor for the test. And so I kind of, I wasn't expecting anything to be wrong.
How old were you at the time?
37.
And so, yeah, you just go in, you have a pap smear like we do, and you just always get that negative response. So I guess my next question to you is, what was your feeling when the doctor, I'm presuming or assuming that the doctor rang you and said, you need to come in? They didn't just do it over the phone?
They didn't. He said, come in. So I made an appointment and went in, and, obviously the anxiety is really high because you know that something's not right, because otherwise they just tell you it's negative. And I had my baby with me, and it was a little bit odd. I felt like I was watching myself, and it wasn't really me. It was really a kind of surreal experience, and I do remember it quite vividly. And he was my GP, and I had quite a good relationship with him, but I was super healthy and fit, and hadn't had big health issues before. At the time, it was, well, you have cancer, and then beyond that, it would, I would find out exactly what that meant, which type and stage and all that kind of stuff. But right then it was, okay, we need to find out more, basically. And then I went out to the car, and I held it together, and I got in the car and then just burst into tears. So yeah, just let it out. And the little one was with me, and I think he thought I was laughing rather than crying, because he did this little giggle, which was kind of a good thing at the time.
How long in between the diagnoses and the actual end, like that initial, well, you've got cancer, and what tests were actually done for you? Like, did you feel like a pincushion? Because I know with diagnoses at the time, you can start to feel like a number. A lot of people kind of complain about that. I just felt like a number, and I felt like I was just going through the motions, and there was no real care about me. So how many tests and how long did it take?
Yeah, the diagnosis was pretty straightforward, I guess. I know other people who've have health conditions that have taken a long time, but cervical cancer is pretty straight up. You get a result. And it's the question mark around the lymph metastases in my pelvis, that didn't come till after the PET scan. So after the pap test, it was working out if it was pre-cancer or cancer. I'm like, well, what's the difference? What does that even mean? So then you start the information overload and that detail, and it becomes quite a rabbit hole. But PET scan was booked in very quickly, and that was clear from the cervix perspective, but it was vague regarding the metastases, and obviously that would mean spreading. It could mean other tissues, ovaries, anything in my hips, and there wasn't a definitive diagnosis on that. So then that became the vague part of, well, how do we treat that? And you understand the medical system more and realise that it's not an exact science, and there are protocols in place. And I didn't feel like a number. I think the people I was in touch with, my GP was great, and my oncologist was fantastic, straight up, very blunt, which I appreciated. That's
perfect.
There was no stuffing around. He joked around.
Had you known anyone with cancer before you were diagnosed with it?
But not, I knew people who'd had abnormal cervical test results before, plenty of those, but no one who'd had, actual cancer results come back, especially without symptoms or anything like that. So, and the doctors explained that it's, it can vary quite a bit, especially with something like cervical cancer. It's not just a simple, everyone's the same. Everyone's condition, everyone's situation is very different. So that was acknowledged.
I guess, the purpose of this podcast is to kind of give people food for thought that might be going through the same thing as you around treatment. Because from my own experience, when you're diagnosed with someone and someone is basically saying, I've done the work to understand this more than you have, and this is the road that I think you should go down, you kind of feel you lose a little bit of empowerment, because you go, I've got to trust this person because he knows or she knows what they're doing. So was the first point of call for you, obviously, chemo, radiation, like the usual stuff, or what was the first Western medicine approach to deal with this?
So after the PET scan, when there was more information to go by, approximate size and all that kind of stuff, the surgery aspect was absolutely the primary treatment. Okay, so cut a chunk out of the cervix, get it out. Question mark then was around what would follow that. So radio or chemo, or a combination of both, or a hysterectomy. So both the radiation and, depending on the type of hysterectomy options, would have been straight into menopause. I wanted to have another child, so you've got that weighing heavily on your mind, but also, does that shorten my life? Does it, all these other questions coming in. What about my quality of life? Does that, feeling like it might age you, all that kind of stuff.
Can I just stop you there also? Yeah. I know with some women that have had hysterectomies too, did you consider your sex life when you were thinking about hysterectomy? Because I know that women are afraid to have it because they may not be able to feel the orgasm or anything like that. Did that come into your head as well?
Look, as a secondary thing, I think depending on what they take out, your sensation is still there. They're not taking out your cervix. They're taking out your cervix and above, not below. So more as a secondary thing, and more later, to be honest.
Okay, sorry, go on. I interrupted your flow.
No, that's all right. So then the recommendation, if you like, from conservative Australian medical protocol was, okay, we'll go with the radio chemo, because if we do the hysterectomy, you have to follow up with one or both of those anyway. So, okay, that's what I was looking at. So I had an appointment with the radio person and, explained all the detail. Didn't bond really well with him, but appreciated that he took me through all of the details. And this was still before the surgery, so working out that. So from then, obviously, that was like, why do I have to make either of those decisions? And I was, it was communicated to me that there were options there, but ultimately it was like, okay, this is what should be done from there. And then I guess from left field came another option.
Okay, good, because that leads me to my next thing. The one thing I will, before we go there, is you've got a husband. So did that become a decision that you two had to make together, or was this just personally it was just all about what you kind of wanted?
he's great at taking in information and dissecting it, particularly at that time. You know, you're at your most vulnerable because you're emotional. It's your own physical body. It's got all, you know, all of that. You're absolutely overwhelmed. So it was probably the next stage where he really kicked in to be more involved. And that's when he found out about treatment called photodynamic therapy. So that, look, it's something that he researched online, which is, you know, kind of, well, okay, what is this thing? But was looking at medical journals and articles, including the Lancet, and some really, really detailed stuff. So he basically filtered all of that and showed it to me. And then he was part of that decision with me. Yeah, it was ultimately still my decision in as far as he and I went. And we were kind of, you know, that pair looking at exploring these options, but that sat well outside the medical people because it wasn't available in Australia. So it's something that's been used for decades for skin cancers. In Australia, you know, if you have a look now, it's at loads of dermatologists everywhere and for all sorts of skin conditions, including skin cancers. But it wasn't available for deeper tissue at that point in time. It was just trying to make that decision around, do we do something that's against what is recommended by doctors in Australia or not?
Great. And was that the only option you were tossing up at the time? Was it just like, so, you know, you've gone, okay, there's this road and this is the guaranteed road, or there are other ways we can do this? Was PDT, is that the acronym for it? Photodynamic Therapy? Was that the only thing you were looking at the time?
Look, there were other supporting things, but that's complementary kind of stuff, you know, so nutrition and all, you know, those other things to help your body, but they're not going to get rid of it, right? So the decision was like, well, how do you make that kind of decision? I'm quite an organised person myself, so I did a project plan. And, you know, it was about timing too. How long before I go to whatever treatment is going to give me the greatest opportunity and success in whatever we choose. Throw in some ovarian tissue being taken out to potentially use later to help with fertility, depending on the upcoming treatment. Throwing around of IVF to get eggs out for that option to be open later. So all of that, I popped onto a bit of a timeline and really decided that we could give it a go to China, come back, do an IVF cycle, as in get the eggs out. And you had to wait to get a PET scan. So do that in between, have a PET scan. If it worked, great. If it didn't, then I'd go back to the traditional radiochemo.
Wow. And what was the timeline that you were looking at for all of that?
A couple of months.
Okay, so flying to China. So just for those that don't know, what's a PET scan?
So PET scans, basically you have fluid through your body, and that's picked up by a PET scan. So it's, you know, your whole body goes in, and it's basically to see how big the cancer was in my cervix and if it was anywhere else in my body, so if it had spread.
Wow. So you had a 1-year-old and then you were contemplating going to China to do a therapy that wasn't tried and tested. I mean, I just love your bravery. Always have. So, yeah, I mean, it does take courage to do that, and fantastic that you had a supportive partner that was along that, because it's really difficult when you're diagnosed, and you would know this too, to convince friends and family who care about you that this is what your choice is, and just have them accept it, especially if you're going off the beaten track and trying something new. So
absolutely. Yeah. And there were people close to me who didn't want me to do it, but were supportive. And there were other people who were on board and said, go for it. You might as well. It's not going to hurt. It's not going to harm, that kind of thing. So, and all of those things weigh on your mind when you're making a decision like that, because it was significant.
Okay. So when did you go to China after that timeline, and did your hubby go with you?
Yep. So diagnosis was in August of 13. And then, you know, the PET scan was soon after. The surgery was soon after that. And then I had ovarian tissue out. And then we went in November, I guess, or 3 months. So basically the treatment in China was a part of a hospital that was set up for user pays international people who just came to get that treatment. and it was for a little over a week. And then the protocol was 2 weeks break, and then having another round of a bit over a week. So yeah, hubby came and baby came, and we went to China. I did a round of treatment. Then we went to Thailand for a holiday, which was the best thing we could have done. Then went back to China for another round of treatment, and then came home.
Amazing. And so were there risks involved with this? And if so, what were they? And did you have to sign things?
No signing things. I think I basically told them I'll be back, for testing, and if it works, great, and if it doesn't, then we'll talk again. So yeah, no, there wasn't any signing. I'd sent medical records over to China. There were doctors who looked at it there. It was my decision and my liability, I guess.
Yeah. All right. So you've done all that. Did it hurt?
No. So the process is day on, day off. So you drink a solution. It's chlorophyll-based solution. So it looks like a really bad green smoothie. It's only a little, like half a glass maybe, but it's really concentrated. That then absorbs into your body and more so into the cancer cells. And then the following day, I would go back and have the actual treatment. So it's infrared light treatment that's applied because the cervix is accessible vaginally. That was how that worked. And basically, it's not, you're not putting poison in your body to kill the cancer cells. It's applying infrared light that reacts with the chlorophyll-based solution to create oxygen, and the oxygen has a detrimental effect on the cancer cells.
Yeah, well, they do oxygen therapy, don't they? I mean, for cancer now, but it's just not this particular way of method. And do they do it in Australia now?
There are studies around for different types of cancer. So there's a little bit, but there's still not a lot happening.
And are you comfortable with saying the name of the place that you went to?
It was called NGPDT, but they're not operating there anymore. I did have a call a couple of years ago asking if I'd be available for someone, like as a patient referee, if you like, to be called, because they were looking at expanding and moving around in different countries. And I'd said absolutely, but I imagine the COVID's ceased all of that. So yeah, I'm not sure what that's at, but there are some studies in Australia.
I guess people can do their own research, really. Photodynamic therapy, that's an interest to you. So it wasn't a given that it was going to work. You've come back home, and how long after the therapy did you realise actually this is working?
So there's a recommended time frame to wait until after any treatment. That happens in Australia for normal treatments. Depending on what it is, that'll determine the time frame. To wait between when the treatment's finished and a PET scan to check the results, because you can have inflammation to start with, then things go down and settle. So in that time, came home, went through a round of IVF and egg collection to get some eggs out for later, depending on what would happen. And then about 6 weeks later, had a PET scan back in Melbourne, and that came back clear.
So unbelievable. On a spiritual level, do you believe this was purely science, or do you believe that there was other things involved? Because on every level with illness, people pray and people do other stuff, and it may or may not work. Was this a purely scientific thing that just worked for you, or did you put other things in play?
Look, I think you can only help yourself by looking after yourself, trying to stay calm. I did heaps of meditation, more than I've probably ever done before. Really tried to look after myself, but I'd always been, as I said, fit and healthy. So the base was there. Look, to me, it was very much science. It's new technology. It disappoints me that it's not available broadly right now, especially because it didn't make me sick. And a lot of people going through a lot of cancer treatment, and they're absolutely smashed by it because it impacts on healthy cells through the body as well. So yeah, to me, it's about the science, about the technology, but with support emotionally and looking after myself to help my body.
And so amazing. You got to keep your cervix, you had another baby, and you did everything right for yourself and your family. So all the naysayers were probably just like, whoa, it actually worked. Amazing. Now, you did mention that you have to see your oncologist still every year. Is that because you're now susceptible to cancer and there's a level that you actually still have to maintain of health?
That's very normal. Yeah, at the start it was once every 3 months. A couple of years later, I had a scare. Things just looked a bit different, but also I was between pregnancies, so things had been a bit stirred up. That was thankfully fine. But so now I'm back to once every 12 months. And it's your regular pap test style plus a couple of biopsies that are taken each time. Yeah, and I've had, got results a couple of weeks ago from the last one.
And are there any particular supplements or things that you're taking to prevent the recurrence of it, or you're just doing, keeping up your amazing healthy lifestyle, but nothing in particular that you're taking?
Yeah, not specifically. Look, at the time, looking into things, I sort of went mostly vegetarian, but I was kind of that way anyway, so that wasn't a big impact. I've always been a sweet tooth and a big baker. I sugar right back. Do I eat sweet things now? Yes, when I want to, but I also found that I don't crave it like I used to, because I did cut a lot of it out for some time. So it's probably a happy medium, if you like.
Yeah, because a lot of the research shows that sugar is very bad for cancer. That the cancer loves the sugar.
Well, basically, when you have a PET scan, what they inject has sugar in it, so it attaches to the cancer cells, and that's, scientists can see that. So if you've got cancer, cutting it down makes sense, because otherwise you're just feeding it. But if it's not in your body, then it's not going to cause it.
Okay, so this is a really important thing. So the Love Your Diagnosis concept here is about, just basically, getting in touch with the fact that you've got this and how to cope with it in a way where you're not working against yourself. So what were you were just saying that you don't love your diagnosis, so I'm going to let you take this away.
Yeah, I like the concept, and I admire that some people are able to have peace with the diagnosis, because it's helped them be who they are, and they've moved through their journey and come out the other side stronger, all that kind of stuff. Part of that I get, but I hated my diagnosis. I still hate it. If I could change it, I would. If I could have had the vaccination for cervical cancer as a preteen instead of getting it, absolutely. I wish that could have happened. Can't change that though. So no, I don't love my diagnosis. There was a lot of shit that came from that. It was really hard and really challenging. Yeah, but I can appreciate that other people can move forward and voice it that way. Yeah.
I suppose because I guess with what you went through, it was a treatment and it worked, and you don't kind of have to live with it every day. Like for me, every day I have to think about maybe a seizure, maybe, so if for someone like myself and someone that has an ongoing condition, I guess you have to learn to love it very differently to what you went through, because it hasn't defined you. You've been able to kind of, in inverted commas, walk away and go, wow, that was a fucking great experience. Not. But the best thing out of it is, and I'm so glad that you were honest about that, because I can imagine it would have been just a horrendous thing to face. Mortality as well, like potentially. Yeah, is that I forgot what I was going to say, but that's all right. I think we've covered it, and I'm not going to edit that either.
I think when you're talking, man, once you've had, I totally appreciate that for you and others. Once you've had cancer, it's always been in your body, and it's therefore naturally one of your greatest fears that to be told it's come back. So that lives with you, but you don't have the day-to-day. Well, in my situation, for example, I had problems with fertility to deal with for many, many years. Pelvic floor needs a lot of work to hold everything up. There are things like that, but that's minor in comparison. Yeah, but it's always there in the back of your mind.
Yeah, that you can't run away from. And you're right. I mean, I don't love my diagnosis either, but I love myself now, and so that diagnosis is part of loving it. And that's the beauty of this podcast, is just to find that truth for people. And what's that saying? What doesn't kill us makes us stronger. And you're an incredibly strong, resilient woman anyway. If I think anything that you would have been diagnosed with, you would have like kicked in the butt big time. For anyone listening that's going through the same thing, if you had a little parting gift of words that you could tell someone who's actually going through the same thing, what would it be as far as looking outside of the square?
I think it's be involved as much as you are comfortable with. For me, I have an exercise science degree. I understand the human body. I wanted to know all the details. I had loads of questions and I needed to know to satisfy what I was okay with going through. I know other people who don't want to look if they've got a cut on their finger. They just want to be told by an expert, here's what needs to happen. I absolutely value the medical profession and the people in it, but I also understand that Australia is pretty conservative, it's pretty risk averse. And so for me, my pathway took the best bits of both, the best bits of what's available and part of the norm here, and also a new technology that, wasn't easy to access, but that worked for me.
Thank you so much for
Be
sharing.
involved and take control.
Take control. Yes, in the driver's seat. Absolutely. Thank you so much for sharing. It's such a great success story. And I hope a lot of people that listen just, get a few little more tools in their toolkit to deal with something like this. Thanks, Bri.
You're welcome.
The Love Your Diagnosis podcast is proudly produced by me. So just to recap a little bit, Briony was diagnosed with cancer and she found that she didn't want to go down the path of getting the hysterectomy and chemo and radiation first off. So what she did was she and her husband looked deeply into photodynamic therapy, which is not an approved method of killing cancer in Australia. It's actually used for skin cancers and other things like that, lung cancer and esophageal cancer. I think it's had some benefit in. But in Briony's case, she went to China, went through the treatment, and it worked for her cervical cancer. The main benefit of Briony's story for those that are going through it is that you can think of other ways, you be creative with your diagnosis. You don't just have to take one person's opinion about what the outcome for you is going to be. And it's really important that other people share their stories so that this information gets passed on. If you enjoyed today's show, at this stage, all you have to do is listen and tell your friends about it, because there could just be a story on here that they've got diagnosed with or that they can relate to, where they get to think outside the square. And a few seeds might be planted in their brains about other ways of dealing with it besides just what the original diagnosis and prognosis is. Thanks for listening. If you want to learn a little bit more about other options for what you can utilise for your wellness journey, click on the link below to the Happy Herb Company. They've got lots of amazing products to assist in getting you started in your wellness journey. Thanks again for listening. I'm Lainey Chait.